Welcome back to Signal 2030, where we explore the scientific breakthroughs shaping our future. Today we're diving into something you've probably heard about, maybe seen advertised: photobiomodulation, PBM.
Or more commonly known as red light therapy, RLT, sometimes low-level light therapy, LLT.
Exactly. It's everywhere now. You see these high-tech clinics, home devices, promising the world, really. Better skin, maybe even better brain health.
It's a really fascinating area, this intersection of light, biology, and, well, technology. And today our goal is to unpack it. We want to look at the actual science, the rigorous stuff behind PBM, see what the real-world uses are.
And help you navigate it all, right? Because it can get confusing fast.
For sure. We really want to separate what's scientifically validated from, the marketing hype, give you the clearest picture we can.
Okay, let's do it. Where does this story even begin? I heard it was kind of an accident.
It really was a classic serendipitous discovery. Back in 1967, a Hungarian physician, Dr. Andrei Mester, he was actually trying to use a low-power ruby laser to treat cancerous tumors in mice.
Okay, so cancer research initially.
Right. But the laser wasn't powerful enough for the tumors. Instead, he noticed something else entirely unexpected on the mice's shaved backs.
What was that?
Faster hair growth, and their wounds seemed to heal quicker, too. It was quite remarkable.
Wow, so he stumbled onto something completely different.
Exactly. He called it laser biostimulation, and that finding really kicked off the whole field.
But it stayed pretty niche for a while, mostly in labs.
For decades, yeah, until a really big turning point in the early 90s, NASA got involved.
NASA. How did they get into light therapy?
Well, they were developing high-intensity LEDs, light-emitting diodes, but for growing plants in space, to feed astronauts.
Okay, space farming. Makes sense.
But then came the aha moment. The researchers working on this noticed their own minor cuts, little scrapes, seemed to heal unusually fast under these lights.
Huh. Just like Meister observed, but with LEDs this time.
Precisely. And that got NASA thinking about using LEDs for humans, especially because microgravity isn't great for astronauts. It affects muscle, bone, wound healing.
Ah, so it could potentially counteract some of those negative effects of space travel.
That was the idea. So NASA started funding key research. They did studies with Navy SEALs for muscle and joint injuries, and with cancer patients suffering from oral mucositis, those painful mouth sores from treatment.
And what did they find?
They found the LEDs were effective and, importantly, safe. This research really validated the technology and, honestly, paved the way for all the consumer devices we see today. It gave it serious scientific credibility.
That's crucial. Okay, so let's get into the mechanism. How does this specific light, red and near-infrared, actually do things in our cells?
Right. The core thing to understand is that PBM is photochemical. It's not about heat. Think of it like photosynthesis in plants, but in our cells. Photons, these little packets of light energy, have to be absorbed by something specific in the cell, a photoacceptor.
Like a lock and key mechanism.
Sort of, yeah. A very specific key fitting a specific lock to kick off a biological process.
And there's a special window of light that works best, the optical window.
Exactly. We're talking about red and near-infrared light, generally between 620 nanometers and 1200 millimeters. In this range, light penetrates tissue pretty well because it avoids being heavily absorbed by other things like hemoglobin, melanin in the skin, or water.
And there's a difference between red and near-infrared, right?
Yes. Red light, say 620 to 750 millimeters, is better for more superficial things like skin. Near-infrared, or NIR, maybe 750 to 1200 millimeter, goes deeper. Think muscles, joints, maybe even the brain.
Okay, and what's the main lock that this light key fits into? The photoacceptor.
The primary target, the main player here, is an enzyme called cytochrome C oxidase, CCO. You might also know it as complex 4 in the mitochondria.
Mitochondria, the powerhouses of the cell, so CCO is pretty important.
Absolutely critical. It's a key part of cellular respiration, the process that makes ATP, adenosine triphosphate. That's the energy currency for pretty much everything a cell does.
So how does light interact with CCO?
Well, the leading theory is called the nitric oxide photodissociation theory. It sounds complicated, but the idea is simple. Sometimes, especially under stress, a molecule called nitric oxide, NO, can bind to CCO. It basically blocks oxygen from binding.
Like throwing a wrench in the works of the cellular engine.
That's a great analogy. It gums up the works, slows down energy production.
And the light?
The photons from red and NIR light have just the right energy to knock that NO molecule off CCO. It breaks the bond.
It clears the blockage.
Precisely. Oxygen can then bind again, cellular respiration gets back up to speed, and you get a surge in ATP production. It's like recharging the cell's batteries.
And what happens to that nitric oxide that gets knocked off?
That's actually another benefit. The released NO acts as a signaling molecule itself. It causes vasodilation.
Meaning blood vessels expand.
Right, which increases blood flow, bringing more oxygen and nutrients to the area. It's a neat little bonus effect.
Wow. So one interaction triggers quite a bit. More energy, better blood flow.
And that's just the start. That initial boost in ATP fuels all sorts of cellular activities, repair, growth, making important stuff like collagen.
What about oxidative stress? I thought light could cause damage.
That's a really interesting point. PBM actually causes a brief, low-level increase in reactive oxygen species, ROS.
ROS. Those are usually considered bad, right? Free radicals?
In high amounts, yes. But this small, temporary burst acts differently. It acts as a signal. It activates protective pathways, like one involving nuclear factor kappa B. This pathway helps manage inflammation and boost the cell's own antioxidant defenses.
So it's like a little stress signal that tells the cell, hey, ramp up your defenses and repair mechanism.
Exactly. It's not damaging, it's stimulating a healthy response. It's a form of hormesis, where a small dose of a stressor leads to a beneficial adaptation.
And that leads to the anti-inflammatory effects people talk about.
That's a major outcome, yes. PBM consistently shows it can reduce pro-inflammatory markers in various tissues. This anti-inflammatory action is key to many of its benefits. Taken together, this science really elevates PBM. It's not just some alternative wellness fad. There's a solid biological basis here.
But it sounds like getting it right is crucial. Which brings us to the dose. You mentioned the Goldilocks principle.
Yes, the biphasic dose response. It's absolutely fundamental in PBM. Sometimes called hormesis again, or the Arndt-Schultz curve. What it means is the effect isn't linear. It doesn't just get better the more light you use. It's more like an inverted U shape.
Okay, explain that. Inverted U.
So too little light, you get basically no effect. You increase the dose, you hit an optimal point, the peak of the U, where you get the maximum benefit.
The just right spot.
Exactly. But if you keep increasing the dose beyond that point, the benefits actually start to decrease. And if you go way too high, you might even inhibit the positive effects or potentially cause harm.
So more is better is definitely wrong here.
Completely wrong. It's a common mistake. People think, oh, I'll just use it for longer, or I need the most powerful device. But that could actually be counterproductive.
That explains maybe why some studies show great results and others not so much.
It's a huge factor in the inconsistency we see in research and results. Nailing the optimal dose is tricky.
What defines that dose? It's not just time, right?
No, it's a combination of things. The specific wavelength of light, the power density, also called irradiance, measured in milliwatts per square centimeter, MWCM.
Okay.
The treatment time, and the total energy delivered, which is called fluence, measured in joules per square centimeter.
That sounds complicated.
It is. And to make it even more complex, the optimal dose changes depending on the tissue you're targeting. Brain cells might need a different dose than skin cells or muscle tissue.
So this whole dosing thing is key and maybe often overlooked.
It's probably the single most critical factor and, yeah, often missed. It really shifts the conversation from, does red light work, to what's the right dose for this specific thing?
Okay, let's talk applications then.
Yeah.
Where does the science show this light therapy really works well? Hair regrowth seems like a strong contender.
It really is. Androgenetic alopecia, or common pattern hair loss. This is one of the most robust, scientifically validated uses for PBM.
How does it work there?
It seems to stimulate the stem cells in the hair follicle, pushing them back into the active growth phase called anagen and keeping them there longer. Plus, that vasodilation effect we talked about improves blood flow and nutrient delivery to the scalp.
And the evidence backs this up.
Pretty strongly. There's FDA clearance for devices for both male and female pattern hair loss. Multiple good quality studies, RCTs, and meta-analyses show significant increases in hair density, count, thickness, sometimes comparable to drugs like topical minoxidil.
Okay, that sounds convincing. What about skin? Dermatology applications? Wrinkles? Skin tone?
For general skin rejuvenation, wrinkles, tone, texture, the evidence is also quite good. Fairly robust. It works mainly by stimulating fibroblasts to produce more collagen and elastin, the proteins that keep skin firm and elastic. Even places like the Cleveland Clinic and Stanford Medicine acknowledge the promise here, but they always call for more large trials.
What about acne? People often see red and blue light devices for that.
Right, often it's a combo. Blue light has antimicrobial properties against the acne bacteria, Cutibacterium acnes. Red light adds an anti-inflammatory effect, reducing redness and helping the skin heal.
So red light on its own for acne is less clear-cut.
Less definitive, yes. The combination seems more effective, and some combo devices do have FDA clearance for acne treatment.
And wound healing, that was one of the original observations.
It was. Mester saw it, NASA saw it. Research suggested it could speed healing significantly, maybe up to 40% faster in some cases. But clinically, results have been a bit mixed, especially for things like reducing post-surgical scars. It really highlights how sensitive results are to getting the dose and parameters just right for the specific situation.
What about inflammatory skin conditions like psoriasis or eczema?
The biological rationale is strong because of the anti-inflammatory effects, but the high-quality clinical evidence from large trials, it's still limited. We need more research there.
Okay, moving deeper now. Arthritis, joint pain.
There's moderate evidence here. Systematic reviews have shown it can decrease pain in conditions like knee osteoarthritis and fibromyalgia. And the FDA has cleared some devices for temporary relief of minor muscle and joint pain, which is significant.
And athletes. Lots of buzz about using it for recovery and performance.
Yeah, there's considerable supporting evidence for that. Studies show it can reduce DOMS, that delayed onset muscle soreness after a hard workout. It can also decrease markers of muscle damage like creatine kinase, lower inflammation, and even potentially enhance performance and muscle growth when used alongside training programs.
But low back pain, that seems to be
Yeah.
a point of controversy, right? Getting the light deep enough.
That is a critical point. Low back pain often involves deep tissues, and there was a really important study in 2021 published in the journal Pain. It was a very well-designed RCT with a near-perfect sham control, meaning the placebo group got a treatment that felt identical but delivered no active light.
And what did they find?
Over a year, they found no significant difference between the real PBM group and the placebo group for low back pain.
Oof, that's a blow.
It certainly highlights the challenge. It doesn't necessarily mean PBM can't work for deep pain, but it underscores how difficult it is to get sufficient light dose to those deep tissues and how incredibly powerful the placebo effect is for pain. We need more robust studies focusing on penetration and dose for these conditions.
Okay, that makes sense. Now let's talk about the brain. This feels like the really exciting, maybe most challenging frontier. Depression and anxiety.
It is exciting and, yes, challenging. The main approach is transcranial PBM, T-PBM, applying light, usually NIR, to the forehead, aiming for the prefrontal cortex.
And how might that help?
The proposed mechanisms are similar, boosting mitochondrial function in neurons, giving brain cells more energy, increasing blood flow in the brain, and reducing neuroinflammation, which is increasingly linked to mood disorders. Some studies also look at systemic PBM, applying light to the body, possibly having indirect effects on the brain.
What does the early evidence show?
It's promising, but definitely still early. A 2024 meta-analysis did find PBM seemed effective for depression symptoms. Intriguingly, it suggested that systemic PBM might have been even more effective than transcranial, which is surprising.
Really? Applying it to the body helped depression more.
That's what this analysis suggested, yeah. But it needs much more investigation. For anxiety, pilot studies and some RCTs have shown promise, even in specific groups like patients on methadone maintenance.
So encouraging signs, but we need bigger, better trials.
Absolutely. Large, well-designed, double-blind, placebo-controlled trials are crucial before we can say anything definitive about PBM for depression or anxiety. Huge potential, but still preliminary.
What about sleep? Can red light help you sleep better?
The theories are interesting. Unlike blue light from our screens, red light doesn't seem to suppress melatonin production, so it might support our natural sleep-wake cycle, our circadian rhythm. There's also a newer idea that it could enhance the brain's glymphatic system, that's the brain's waste clearance system that's most active during deep sleep.
Sounds plausible.
Yes, it definitely ties into our recent episode on sleep, so listeners interested in that topic should definitely check out our 3-part series.
What about the actual studies?
The evidence is quite mixed, honestly. One study on elite female basketball players found it improved their subjective sleep quality and boosted melatonin. But other small studies found no effect, or even negative effects in some cases. And that 2024 meta-analysis on depression, it looked at sleep outcomes too, and found no significant overall benefit. So it's an intriguing area, but the research just isn't there yet to make strong claims. Needs a lot more work.
Now, it's really important to distinguish PBM from the standard light boxes used for seasonal affective disorder, SAD, right?
Oh, absolutely critical distinction. They're often confused, but they work very differently. Standard SAD therapy uses very bright white or blue enriched light, usually 10,000 lux. It targets the retina in your eyes to directly influence your circadian rhythm and mood regulation, mimicking sunlight.
Okay, so it acts through the eyes.
Right. PBM, on the other hand, uses much lower intensity red or NIR light. The theory is it works through those mitochondrial mechanisms we discussed, not primarily via the retina for SAD.
And is there evidence PBM helps with SAD?
Despite what some companies might claim, there's really a lack of high-quality evidence supporting PBM specifically for SAD. The expert consensus strongly recommends sticking with the traditional, evidence-based bright light therapy boxes for SAD.
Good clarification. Don't throw out your SAD lamp for a red light mask. Okay, what about traumatic brain injury, TBI?
This is another really significant potential application. The rationale is strong. Help injured neurons recover by improving their energy production, mitochondria, ATP, and increase blood flow to damaged areas.
In the research.
Early days, but promising. Pilot studies looking at chronic mild TBI have shown some significant improvements in cognitive functions, things like executive function, verbal memory. There are many clinical trials underway right now.
So still experimental, but definitely one to watch.
Exactly. Strong biological basis, positive early signals. It's a very active area of research.
Okay, so let's shift gears. If someone is interested in trying this at home, the market is flooded with devices. Wands, masks, belts, huge panels. How do you even start to figure out what's good?
It's tough. You really have to look past the marketing and understand the specs. First, wavelength. As we said, red light, maybe 630 to 660 millimeters, generally for skin. Near infrared, think 810 to 850 millimeter is better for getting deeper.
Should you look for devices with both?
Often, yes, especially if you want versatility. But be a bit wary if a device lists tons of slightly different NIR wavelengths. It might just dilute the power at the most effective wavelengths. Focus on those core ranges.
Okay. Next up, power density or irradiance. You said this was critical.
Absolutely critical. Higher irradiance means you can achieve the target dose in a shorter time. But here's the huge catch. The inverse square law.
Right, the campfire analogy. Light intensity drops fast with distance.
Exactly. So when a company gives you an irradiance number, you have to know at what distance they measured it. A big number measured right on the surface of the LED means very little if you're using the device 6 inches away.
So what should people look for, realistically, at a typical treatment distance?
As a very general guideline, maybe 20 to 50 milliwatts per square centimeter for skin treatments, and ideally 50 to 100 milliwatts per square centimeter or more for deeper tissues, measured at that 6-inch or intended treatment distance.
And finding reliable numbers can be hard.
It can. Some companies are transparent, maybe offer third-party testing, others, not so much. Some even use the wrong tools, like solar power meters, which aren't accurate for measuring therapeutic LEDs and can give wildly inflated readings. You need to be skeptical.
Okay, what about regulations? FDA approval versus FDA clearance. This trips people up all the time.
Huge point of confusion. Let's break it down. FDA approval is the gold standard. It's for high-risk devices and requires rigorous clinical trials, proving both safety and effectiveness for specific claims.
And red light devices are rarely, if ever, FDA approved.
Almost never. If a company claims their RLT device is FDA approved, that's a massive red flag. It's almost certainly false.
So what most of them have is FDA clearance.
Right, usually via the 510(k) pathway. This is for lower to moderate risk devices, Class 2 medical devices. To get clearance, the manufacturer has to show their device is substantially equivalent to another device already legally on the market. It mainly demonstrates safety and equivalence for a very narrow intended use, like temporary relief of muscle spasms or adjunctive use in treating acne.
Crucially, it does not mean the FDA has validated all the broad health claims the company might make in its marketing.
Exactly right. Clearance is primarily about safety and basic function equivalence for a specific, limited purpose. It's not an endorsement of efficacy for everything advertised.
In terms like FDA registered or FDA certified.
FDA registered just means the company has listed their facility and device with the FDA. It means basically nothing about the device itself. FDA certified isn't even a real FDA designation. Ignore those terms.
So the best bet is to look for 510(k) clearance for a relevant intended use, but remain critical of broader claims.
That's a good approach. You can actually search the FDA's 510(k) database online to verify clearance.
Good tip. So weighing options. At-home device versus professional treatments in a clinic.
It's a trade-off. At home. Big pro is convenience, long-term cost potentially lower. Cons, huge variability in device quality and power, it's buyer beware. It also takes real commitment, consistent use over time, and results are often slower, more subtle because the devices are usually less powerful.
Okay, and compared to professional treatment?
Yeah, pros. You get trained clinicians, often using much more powerful medical-grade equipment. Results might be faster, more predictable. They can create customized treatment plans. Cons. Definitely the cost and the inconvenience of appointments.
So the choice depends on your goals and budget.
Pretty much. If you have a significant medical issue or want faster, more dramatic results, professional might be the way to go. For general wellness, mild concerns, or maintenance, a high-quality home device could be suitable if you have realistic expectations and choose wisely.
What about safety overall? Is PBM safe?
Generally, yes, it's considered very safe. It's non-ionizing radiation, no UV, but there are potential risks to be aware of.
Such as?
Eye safety is paramount. You absolutely must use appropriate protective eyewear. The intense light can damage the retina.
Okay, eye protection always. Anything else?
Skin burns or irritation are possible, especially with overuse or if a device is faulty or held too close. Tattoos can absorb the light differently, potentially causing discomfort or fading. And with transcranial use, some people report mild temporary side effects like headache or irritability.
Are there people who shouldn't use it? Contraindications?
Yes. Anyone with photosensitivity conditions or taking photosensitizing medications, things like certain antibiotics, tetracyclines, or acne meds, retinoids, should be cautious. It shouldn't be used directly over active cancer tumors. There isn't enough research on use during pregnancy. People with seizure disorders should be careful, especially with pulsing light. Avoid direct application over the thyroid gland or over open wounds or active infections.
The bottom line seems to be, talk to your doctor first.
Absolutely, especially if you have any pre-existing conditions, are pregnant, or taking medications. It's always the safest approach.
Knowing all this, what are the biggest hurdles the field still faces?
A major one is definitely the placebo problem. Designing good sham controls is really hard. How do you make a placebo treatment feel exactly like the real thing, especially for subjective things like pain or mood?
That 2021 low back pain study really drove that home.
It did. Its rigorous sham control was key to its finding. It shows how difficult it can be to separate the true effect from expectation in these areas.
And the lack of standardization you mentioned earlier.
Still a huge issue. Researchers use different wavelengths, different power densities, different treatment schedules, pulsing versus continuous wave. It makes comparing studies and drawing conclusions incredibly difficult. We desperately need more consensus on optimal protocols.
And for deeper applications like the brain, that problem of scale,
Right.
can consumer devices really deliver enough light?
That's a critical ongoing debate. How many photons actually get through the skull and reach the brain tissue with typical consumer devices? Some argue it's a negligible amount, far below what's shown to be effective in lab settings. Bridging that gap between animal studies and human applications with non-invasive devices is a major technical challenge.
Despite these challenges, the future still looks bright, right? What's on the horizon?
Oh, absolutely. There's exciting work in neurodegenerative diseases. Early studies on Parkinson's suggest potential improvements in mobility and cognition. In Alzheimer's models, PBM has shown it might reduce beta amyloid plaques. Very early, but promising.
And eye diseases.
Yes, growing evidence for things like dry eye disease. And significantly, the FDA has authorized a device, the Valeda system, for treating dry age-related macular degeneration, AMD. That's a big step.
Wow. And you mentioned something really cutting edge. Photobiomics, affecting the gut microbiome with light.
Isn't that fascinating? The idea is that applying PBM to the abdomen might beneficially shift the composition of your gut bacteria. Given how important the microbiome is for overall health, this could open up entirely new avenues for preventing or managing chronic diseases. It's really paradigm-shifting stuff.
And the devices themselves, getting smarter.
Definitely. We're seeing more combination therapies, integrated PBM plus blue light, or designed to be used with exercise protocols. Though, interestingly, some combinations don't work well. PBM right after cryotherapy, for instance, seems to reduce the benefits.
Good to know.
Devices are getting more sophisticated too. Smart app integration for tracking and protocols, multi-wavelength options, different form factors like flexible wraps. The technology is evolving rapidly.
And the market reflects that interest.
Massively. The global light therapy market is booming, projected to be worth well over $1.5 billion by 2032. There's huge consumer demand for non-invasive wellness tech you can use at home.
Okay, so wrapping this up, Photobiomodulation, red light therapy. It's a potent biological tool.
Mm.
Not magic, not a gimmick.
Exactly. Its success really hinges on precision, the right application, a quality device delivering the right parameters, and a protocol tailored to the goal.
Right. The strongest evidence seems to be for things where the light can easily reach its target. Hair regrowth, skin rejuvenation.
Right. And areas like neurological health show immense potential, but there's still emerging frontiers needing much more solid research.
So final takeaways for our listeners.
Be critical. Be educated. Don't just believe the marketing hype. Look for transparency about specs, especially irradiance at distance.
Match the tool to the task. Maybe a good home device for superficial stuff, but professional help for complex medical issues.
And remember that Goldilocks principle. The dose is key. More power isn't always better. Understanding the parameters is more important than just chasing the highest numbers.
And above all,
Talk to your healthcare professional before you start anything, especially if you have health conditions or take medications. Get professional advice.
as we learn more about how light speaks to our biology, what else could we influence? What other processes might we gently nudge towards health and healing using light?
It's a fascinating question. What new frontiers will light illuminate for us in the next decade or two?
Definitely something to think about. Thank you for joining us on Signal 2030.
See you next time.